Whenever you have a headache or catch a fever, you often look for some kind of drug to take. All you need to do is look for your symptoms and take the corresponding Advil or Tylenol. Most people take for granted the healing effects of medicine and do not care for how the processes actually take place. Well, they really shouldn't. For me, however, knowing what a drug does is only part of the knowledge in my pursuit to become a pharmacist. Although this profession deals mainly with the management and distribution of drugs at a clinic, I am also required to know, through the disciplinary study of pharmacology, how medicine affects the users neurally and biologically. Pharmacology deals with the works, the underlying activity that goes on, especially with the nervous system after you swallow the pill. To get to the nervous system, a drug would normally have to diffuse through the blood and stream to the brain. However, this is not without overcoming a blockade called the blood-brain barrier. The blood-brain barrier is a network of vessels and branching capillaries that have a highly restricted permeability. Because of this, it is difficult for the particles of most drugs to penetrate directly through the nervous system. In general, a molecule should be lipid-soluble, electrically neutral, and base-like to be able to diffuse across the barrier. But there exist other bypass strategies. Intranasal intake of drugs provides the rapid delivery directly to the brain from the nasal cavity that can take effect as quick as 5 minutes. However, there is a restriction. Only limited volume of the drug can be sprayed into the nasal cavity. Injection, especially by IV, is another common route for administration. Because every neuron is supplied with its own blood vessel, drugs are delivered directly to the neuron following transport. Although it is effective, proper injection might impose pain upon the patient and often requires the supervision of his trained staff. As new technologies become available, the size of particles can be feasibly manipulated. The use of highly fine nanoparticles is commonly used in slipping through the brain's rigid membranes. Being able to control the size allows evenness in dosages and designation of solubility, which affects the rate of absorption. Considering the other part of the nervous system, drugs also serve to repair the spinal cord. Most of these damages come from short circuits caused by tears in the neuron's protective sheath. One of these drugs, called 4-aminopyridine 3-methyl hydroxide, insulates breakages currents so that conduction between nerves can resume. But how do drugs affect our brain and behavior? Mentioned earlier, neurons or nerve cells make up our entire nervous system. Drugs interfere with neurotransmission, the process by which neurotransmitters, chemical messengers, reach an activation site and give us the sensations we feel. We can think of neurons like the properties around the community. Just as neighborhoods can be adjacent to other neighborhoods and in turn to convenience stores or postal offices, there are networks which connect functionally associated neurons with each other. Neurotransmitters, on the other hand, can be thought of like people ourselves. Just as we use an alarm clock to get up in the morning and leave our houses, neurons must be stimulated enough for action potential or the firing of neurotransmitters to take place. As neurotransmitters leave the main body of a neuron, they begin to travel along a tail-like structure of the nerve cell called the axon. These are like roads that connect one property to another, or like the rails connecting one train terminal to another. When neurotransmitters reach their designated cell, they go through a synapse, a structure that allows electrochemical signals from the neurotransmitters to be passed on to the receptor site. This is analogous to people getting off the train, going through the terminal gates, and finally arriving at their workplace. Just as there are many different people and occupations, there are many different types of neurotransmitters. Each one is associated with a particular role that gives us a unique effect while functioning in the nervous system. Also, depending on the amount of neurotransmitters that bind to an activation site, functions can be impaired or enhanced. What we consume and how much of it affects the intensity of a specific impulse that is felt. The more neurotransmitters that are stimulated, the more of the sensation that is felt. Serotonin, a particular neurotransmitter, plays a role in relaying signals that deal with our mood. This includes neurons that are associated with sleep, appetite, memory, desire, learning, and social behavior. As depression is becoming common, development for serotonin deficiency, antidepressants, and most notably Prozac is prescribed to restore the levels to normal. Dopamine, another common neurotransmitter, is associated with motor movement and alertness. The more dopamine we have, the more emotionally attentive we are. Neurons affiliated with dopamine are one of the most commonly excited ones, with the inevitable intake of caffeine by frequently bought beverages such as soda and coffee. Another way for drugs to affect neurotransmission is to block reuptake, the absorption of a neurotransmitter after it has produced its impulse. Cocaine is a common reuptake inhibitor that is not only prevent the removal of dopamine and serotonin from the synapse, but also stimulate their neurons as well. Although drugs are used to enhance our behavior and stabilize our emotions, there are drawbacks. If a drug is used too often, there is a possibility that the user will become dependent on it. When this happens, the body recognizes the drug as a primary source of a neurotransmitter and recedes from producing its own. Finally, restoring your brain to square one from the rush of our daily lives is possible with a counterpart to neurotransmitters called inhibitory neurotransmitters. One of these, gamma-aminobutyric acid, or GABA, is found throughout the brain and is responsible for relaxing our excited nervous system. Without it, sensations would build up and become irritable,